This is a discussion about your amyotrophic lateral sclerosis, oftentimes referred to as ALS or also known as your Lou Gehrig's disease. So class, when I talk about your amyotrophic lateral sclerosis, it is a progressive degenerative disease involving the motor system. So you highlight motor system. Now, etiology. This is usually caused by the excess of glutamate, which is a chemical that is responsible for relaying messages between your motor neurons. So, studies have shown that in patients with ALS, there is an increase of your glutamate. So, what are the manifestations of these patients? Your patients class with ALS would manifest with fatigue, progressive muscle cramps, fasciculations, and incoordination. They would have progressive weakness and atrophy of the muscles of the arms, legs, and trunk. And then class there will be spasticity and overactivity of your deep tendon reflexes. About a fourth of these cases would have cranial nerve weakness, and that would manifest as difficulty of talking. Okay, they would even have difficulty of swallowing, and they would even have difficulty of breathing. The common cause of death for this patient is your infection and respiratory failure. Okay, plus the progression of respiratory failure in your ALS is quicker compared to that of your myasthenia gravis and then even of your GBS. Now, assessment findings. In your EMG and muscle biopsy, it would be found out that there is a decrease in the number of your functioning motor units, whereas an MRI would show high signal intensity in the corticospinal tracts. Okay, so if we have ruled out other neurologic disorders and then there is a decrease in the number of functioning motor neurons or units, would suspect ALS or your Lou Gehrig's disease. Then for the management. Okay, so class, our management for this one, there's no specific treatment. It is symptomatic and function focused, meaning if your patient is having problems with breathing or respiratory arrest, would be giving mechanical ventilation to our patient. Okay, if your patient class is having problems with your glutamate, so we are giving your glutamate antagonist. But please take note that the use of your glutamate antagonist is still under investigation. Okay, so the glutamate antagonist class is not a specific treatment, but it is intended to slow the deterioration of your motor neurons. Okay, one of our problem is also spasticity. So to decrease the spasticity, you'd have your baclofen, dantrolene, or diazepam. Okay, so they would decrease the spasticity, hence decrease the pain experience of your patient. And then other than that class, administration of ceftriaxone is also under investigation. Okay, for the patient with respiratory problem, mechanical ventilation is also indicated. Now, class, I understand that there may be confusion on your part on the signs and symptoms of these neurologic disorders that we have discussed. This slide is a summary of the 5 neurologic disorders that we have touched. Okay, so you have your multiple sclerosis, Parkinson's, myasthenia, ALS, and your GBS. Now, class, you need to remember if this would involve the CNS or the PNS. Okay, so if you would look at multiple sclerosis, it is an CNS problem and autoimmune in origin. Hence, there is demyelination of your brain and spinal cord. So notice that the signs and symptoms of your multiple sclerosis are related to that of your brain and spinal cord. In your Parkinson's disease class, notice that the signs are also related to that of your brain and spinal cord. It is a degenerative disorder that would involve the decrease of your dopamine. Okay, so that's why the signs and symptoms are related to dopamine decrease. Your myasthenia gravis, on the other hand, would involve the peripheral nervous system. So notice that I have been mentioning in myasthenia gravis that the part that are affected are your cranial nerves and then your peripheral nerves. So this is an autoimmune problem that results to the destruction of your ACH receptor sites. Okay, so you have a problem with your ACH receptor sites. Now, for your amyotrophic lateral sclerosis, it is also a PNS problem, which is degenerative. It is attributed to the increase of your glutamate. So class, you need to put in your minds that the damage in your amyotrophic lateral sclerosis is related to your upper and lower motor neuron damage. Okay, so because of that, your patient is manifesting with signs of flaccidity and even signs of spasticity. And then you have your GBS. So your Guillain-Barré syndrome is considered to be a peripheral neurologic system problem, which is autoimmune. And then as mentioned, it is also related to demyelination of your peripheral nervous system. Okay, so that's how you would differentiate your multiple sclerosis from GBS, because class, your GBS is peripheral. Your multiple sclerosis, on the other hand, is central nervous system. Okay, now you can try to pause this slide and then try to connect the signs and symptoms that you have learned from those disorders to this slide. Okay, that might help you master, okay, the signs and symptoms and then the management also for these disorders. Okay. Thank you very much for your attention. Our next topic will be talking about your spinal cord injury.